November 2018, Horizons of Friendship accompanied two maternal and child health workers from Totonicapán, Guatemala to Rankin Inlet, a vibrant and predominantly Inuit community in the Canadian North. The Guatemalan visitors are part of Horizons and its Guatemalan partners, Pies de Occidentes, project to bolster maternal, newborn, and child health among the indigenous Maya Quiche population in Totonicapán. Funded by the Government of Canada, the project is helping reduce maternal and child deaths by providing culturally relevant technical training for 1,000 traditional Maya Quiche midwives, commonly known as comadronas, and more than 750 Guatemalan public health workers. This project is also providing the mass provision of medical equipment and nutritional supplements to public health clinics and the area's only public hospital, as well as a wide-ranging health promotion campaign in the Maya Quiche language. All of this work is done in close collaboration with the Guatemalan Ministry of Health.
Well, Canada's feminist international assistance policy is unprecedented in the way that it places women and girls at the forefront of our international assistance efforts. And among the key challenges that women face around the world is a range of barriers to accessing quality, appropriate health care. To try and help address those barriers, Canada has committed $3.5 billion to improving the health and rights of women around the world, as well as an additional $650 million to address critical gaps in sexual and reproductive health and rights. To deliver on those commitments, the department undertook a $379 million call for proposals to support maternal and child health initiatives in partnership with Canadian organizations, Canadian civil society organizations. And the Reducing Gaps project with Horizons of Friendship is helping to contribute to that commitment.
The visit to Rankin Inlet, Nunavut is part of Horizons' efforts to engage Canadians on the maternal, newborn, and child health challenges faced by Indigenous communities in Guatemala and Canada. Margarita, a comadrona, and Maria del Rosario, the head nurse from the Totonicapán Ministry of Health, were accompanied by Horizons Program Manager Renee Guerra and Global Affairs Senior Development Officer Leslie Campbell. Together, the group met with elders Johnny Ayarak and Monica Udjuk to learn and share experiences about the struggles Indigenous peoples face both in Canada and Guatemala related to maternal, newborn, and child health.
One of the elders whom we met, Johnny Ayarak, who's carrying on the tradition of his father, a founder of Rankin Inlet, in sharing his knowledge with visitors and obviously with the younger generation living in Rankin Inlet. He told us an incredible story of how this, this community, which wasn't even a settlement, right, came to be. It arose out of a mining operation that opened up in the early 50s, and I think the community definitely values that history of the community. He also shared his own personal history as a young Inuk man, originally living off the land with his family, and then slowly transitioning to living in a settlement, essentially. Also shared a small bit of information on his own experience in residential school, which lamentably, and as a Canadian, quite shamefully, has also affected the Inuit peoples in Nunavut. So he shared with us a little bit of that experience and how difficult it was to be taken from your family, to be forced to speak French in this case, and to be chastised for speaking Inuktitut or practicing his cultural traditions. So,
and of course, our elder is going to give you more knowledge. Monica is one of the most respected person in Rankin Inlet.
Again, another incredible moment. Mrs. Monica Udjuk, with the help of a translator, she shared with us what it was like for her to give birth 13 times, right? And the first couple of those births were on the land in a traditional way where the only person who attended the birth was her older sister. and a remarkable experience that was interestingly similar to what families in Totonicapán go through, right? In this case, more with the help of a traditional midwife, the comadrona.
The group had the opportunity to reach hundreds of people living in Rankin Inlet and beyond through a program on the local radio station with simultaneous translation to Inuktitut. Over the course of the 2-hour program, we spoke about our project in Totonicapán, Guatemala, and fielded questions from curious listeners who called in to ask questions about Guatemala. Tell us a bit more about the similarities and differences between maternal and child health in Guatemala or Totonicapán and Rankin.
Well, I mean, the first thing, of course, the differences are quite striking, obviously, just in terms of the climate, in terms of the land. Remember on one particular outing during the visit to Rankin Inlet, we were out where some people may call the middle of nowhere. Folks there, and I think us as well, after appreciating the beauty of it, would call it the land, right? And just the expanse where you could see for kilometers and kilometers on end past the horizon, this beautiful icy landscape. Totonicapán is mountainous, you know, it's mountainous, it's subtropical, although it is a little chilly by Central American standards, not minus 50 chilly though. Obviously you can start with that, and that leads you to, when we talk about women and children's health, to realize some of the differences when it comes to care around those things in those two different settings. You can imagine them right off the bat. We were told stories of birth on the land before women were forced, obligated to give birth in health centers farther south. You know, the conditions under which they had to give birth obviously were conditions that required an incredible amount of ingenuity on the part of the people living on the land, the Inuit. And we learned about that. We you know, and even within those differences, you see some of the similarities. So there are challenges in accessing health services under those conditions where there's a sparsely spread population in very cold, in a very cold environment. You need to access those services. How do you get there? You know, it's a challenge. Totonicapán, very similar, although much more densely populated, right? Totonicapán is 1,050 square kilometers, whereas Nunavut as a territory is more than 1 million square kilometers. Obviously, it's incomparable. And yet, the population of Totonicapán, a woman living in a remote rural community, right, very similar to a woman living in a remote rural community in Nunavut, can have very serious life-threatening barriers when it comes to accessing health. So, you know, even within those differences, you see right off the bat that there are significant similarities. Of course, both of the populations affected, and this is probably the crux behind this entire exchange, are indigenous, right? So you have Maya Quiché peoples in Totonicapán, and you have Inuit peoples in Nunavut. Both of them face daunting challenges. Both of them face a disproportionate amount of needless deaths among women who are pregnant or who have given birth. The same for children. So, you know, it was a chance to just begin to explore some of those issues, some of those topics. It was a chance for those living there to also learn a tiny bit about what the reality is for women and children in Totonicapán as well.
Bueno, pues realmente para mí fue una muy buena experiencia poder conocer un país, Canadá, que sus indicadores de salud son muy buenos, son uno de los mejores países que en la salud los indicadores son muy buenos. Conocer que hay una población indígena en Nunavut que está rescatando las prácticas de la atención del parto a nivel de la comunidad, a través de parteras que han tenido ya esta educación a nivel ya universitario y que bajo la responsabilidad de ellas está la atención de estos partos. Fue realmente muy interesante ver que dos países tienen ciertas similitudes en relación a la atención de la salud materno-infantil.
No encuentro qué decirle porque ni en mis sueños ese lugar que fui a conocer. Es un lugar muy bonito que nunca me imaginé llegar hasta acá. Gracias a Horizonte de Amistad, que con coordinación con Pies de Occidente me llamaron y vine a conocer muchos lugares aquí en Canadá, muchas experiencias llevé, y lo que yo quiero decir, o un llamado que hago a las autoridades de aquí de Nunavut, de todo Canadá, quiero pues que los partos que sean atendidos en la comunidad. A mí me da pena que las señoras viajan todavía y no sabemos el momento en que ellas pueden dar a luz. Entonces, todo se puede, no hay cosa imposible, todo es posible. Eso es lo que quiero yo de aquí a unos cuantos años o meses, que los partos ya sean atendidos en la comunidad. Y muchas gracias a Horizonte por esta oportunidad que me cedieron. Estoy acá en Canadá. Muchas gracias. Estas son mis únicas palabras. Muchas gracias.
I would like to think that this visit, in some small way, also contributes to this, hopefully, national effort at reconciliation and honoring a past that was very, very difficult for Indigenous peoples, and it continues to be in many ways.